Hi, I am Luna. I am vet and PhD student at Federal University of Paraná in Brazil. And my presentation is about prevalence of Eimeria lesions quantified by ISI application in commercial farms of broilers in South America. So I started my presentation a little differently in order to make you think about some points of our production systems. So when we are working in veterinary clinic, whenever we want to know about the clinical history of that animal, we just need to do is ask to his owner about the animal clinical science. So when we are working in production system, it's a kind of a little differently because not necessarily I need to know about that specific animal. What mattered to me, it's about another 20,000 other birds that has in the barn or the history of that property. So for this reason, I'm used to say that we need to do a monitoring system inside each one of these properties or burns to understand the history, a response of sanity or performance, and if all the season, if all the year in that property. So thinking about increased use in the field technology and the way to facilitate it, a practical data entry and access in real time, we put the IC macro. The IC macro is a tool previously developed and published by ICE into an app. So what is the IC macro tool? So it's a necropsy system where we have a pattern of lesions through scores. And these lesions are divided by systems like locomotor systems, respiratory, gastrointestinal organs, intestine, and coccidiosis. So for example, in intestine, intestinal systems are divided by segments, so duodenum, jejunum, ileum, and cecum, and each one of these segments has parameters. So these parameters are lesions. In these lesions, we receive a punctuation, the 0, 1, 2, 3, as I will show to you now. So for example, here, this is a picture of the score 0, or which means no lesions in the gut. Score 1, this is a lesion of coccidiosis maxima in ileum. So I will show to you here. Okay, all these red points, it's characteristic for the Eimeria maxima. So score 1, it's the presence of this type of lesions. Score 2, almost 50% of all the organ is affected with these lesions. Score 3, it's a very severe and intense lesions caused by this organ. This lesion in the organ. So the different tool that we have in this system, in this method, is the impact factor. So what is the impact factor? The impact factor is each one of that lesions receives an impact factor differently according to the severity of each lesions to the bird. So for example, coccidiosis in maxima receive impact factor 3. This is automatic and pre-recording in the system in the app. So the coccidiosis maxima received impact factor 3. This impact factor is according to the all inflammatory situation that these lesions cause in the bird. So for example, if we receive a score 3, that lesion, the maximum score for these lesions is 9. So in this way, we could monitoring all the systems because I know that the maximum lesions observed by Eimeria is 9. in my birds, for example, I have 5, and then or 6, I can understand how close is the maximum score. So the indigested food, for on another hand, is a mild lesion. So receive impact factor 1, because not necessarily all that food that I found it in the intestine are affected and inflammatory compared to inflammatory caused by coccidiosis. So the ISI total, it's the sum of all these parameters that I evaluated, and then in resume I have all the situations according to lesions, and I talk with my other colleagues with numbers. So all these lesions are translated to numbers. The impact factor is calculated according to the loss of organ functionality. So how's it working the app? This is the app. There is all the pictures in the app 0, 1, 2, 3 of all systems, locomotor, respiratory, gastrointestinal, intestinal organs, and then I just need to choose which one of these lesions is close for the bird that I evaluated, and then all the app do the rest. And then all the data are scanning, and I have a centralization data and are available in the digital platform that I could do some statistical analysis. So for this study, the monitoring system, the period that I evaluated was from January 1st to December 31 from last year. The way to our confidentiality system, this is very restricted. I have only the numbers of files, the files that we evaluated. So the number of files that we received was 30,656 files of lesions in South America. So the collected data, 5 birds per barn was collected to do this study of this analysis. 25 to 35 days of age are the age of these birds. All the birds were euthanized by cervical dislocation and was evaluated by flock. So this more than 30,000 files that we received, the files about coccidiosis, the lesions characteristic in the coccidiosis, it was 4,784 files of coccidiosis, which means 50% of all the lesions found represent coccidiosis. 5.3% present any lesions of Eimeria, acervulina. 5.2% present any lesions of maxima, and 5% present any lesions of tenilla. So we observed as well this September has present the higher presence of the coccidiosis, lesions of coccidiosis. So 70.8% represent the presence in September. We also observed that in this period, there was an increase of respiratory lesions, small intestinal lesions, yolk rotation, and pancreatrophic. These lesions may be associated with other factors like change of season, variation of ground quality, and poor management. So this is very important to respirability and understand what could be an answer for these diseases. So as consideration, I found 2 great recent studies about the cost of coccidiosis per bird. The first one was done by Dr. Blake and the other authors. They estimated 16 pounds sterling, is around 22 cents cost per bird. In another study was realized by Dr. Rashid and other authors, and they estimated 27 cents per bird. In both studies, they considered this cost with medication and also with losses in performance. So with this data, I did myself as estimative for the lesions that we found last year. And considering an average of 55 cents per bird, according to our government data, 8 billions of broilers are slaughtered here in South America per year. So considering that we found it 15% of the birds that present any type of coccidiosis, we estimated $300 million a year are spent with coccidiosis cost. So as conclusion, our data reinforce this temporal variation in prevalence of coccidiosis in broiler flocks. So this is a huge disease. It's very important disease, important disease, needs adaptation. So for this region, it must be monitoring. So with the monitoring system, like the ISI app, we have access of all data, the field data in real time. It's possible to allow us agilize decisions and providing possible interaction between all the data. So this is very important, has a monitoring system to help you understand all the sanity of all your flock. So I'd like to thank you to watching my presentation, and I would like to thank the PSA for all the support and the opportunity.